Hi, I'm Dr. Asghar Husain. What does an orthopedic surgeon actually do? Well, I try to help people solve problems. Typically, someone will come with an issue. I'm having pain. I fell down. I hurt myself. And the way I look at pain is a signal. If our bodies are well designed, the pain is telling us something. So my role is to figure out, what do we do with that? And in order to do that, I like to look at three elements. So the first one is the structure. That's the thing everybody talks about. And so I listen, I do a physical examination. Sometimes we do other tests, x-rays, MRIs, CT scans, and we analyze the structure. And the second part of that is we look at function. And function is a product of how everyone has used a part. For example, if somebody comes in with shoulder pain, someone who has trained the muscles of the shoulder so that all the bones get out of each other's way is going to do better than someone who hasn't. So we consider the function. And then the third thing is we consider the health. If you notice, I'm not saying age. The issue is not really age. None of us are getting younger.
Wait a minute. Hold on.
Yes.
What do you mean age is not really an issue? Because what about when you get older, you heal less fast. You have osteoarthritis. You have bone degradation. You have all this stuff going on. So how is age not an issue?
It's not that age is not the issue. It's that in the context of what I'm talking about, what really matters is how have you managed your age? So for example, someone who's 50, who's never exercised, is actually going to be at a major disadvantage, even compared to somebody, let's say, who's 80, who their whole life just spent cross-country skiing and working on their health and has a regular exercise, sleep, nutrition, mental health habits. It really is there to focus on what are you actually doing to manage your health. That is one of the goals I want people to really get out of this. It's less about, hey, age. Because what I find is that if we just look at age, most everybody will say, well, I'm getting old. And it really is just excusing what you have as a result of just age alone, which is not the case. So the point of what I'm saying is that don't just blame age as the cause of your issues.
So you're saying that exercise is going to make that much of a difference between someone 50 and 80?
1,000%.
Well, what about those people that argue that, oh yeah, what about those people that are professional athletes or exercise a lot and actually screw up their joints even more?
Well, that's a topic of other videos because it's a really, really good point. It's the dose. It's the dose that really makes the medicine. And ultimately, if you take any medicine, because I think exercise basically is medicine, and if you take that and you just go all the way beyond what is going to allow you the proper recovery, then you can have concerns. And that's a reason why you'll see people who function at an extremely high level for many, many years. But when you double click on it, what you find is that actually during that time, there were many periods of time they needed to recover. They didn't build in the recovery. And I'm really oversimplifying a complicated topic, but I think that would be a subject of future discussions.
Right. So it's basically that whole idea of, the middle ground. It's not one extreme or another as far as the exercise.
Yeah, again, think of it like a medicine. If you're going to dose a medicine, you don't give the same thing to each person without any thought about it. You really have to adjust it to the person and what their goals are. Again, that's a whole separate topic, which is a very, very important question. But the point of all this is really don't just use your age as a reason to do A, B, or C. Look at what have you done for the years that you have.
Okay, so the takeaway for me is I got to get into shape.
Yes.
All right.
The issue is, what has someone done with the years that they have? If we put all that together, look at the structure, look at the function, look at the health, and figure out what is the best next step. For some, that might mean, hey, let's start you off on a rehab program. Let's work on the function. Let's see whether we can improve the way the shoulder blade muscles are moving, or in the setting of somebody with a knee problem, maybe change the way the muscles are working with the idea that you have to change something in order to make some progress, and then reassess it and see. Now, there are situations somebody comes in and they had an injury and the structure is really damaged, and sometimes we will put together a program on how to put the pieces back together. But in order to get someone back to the quality of life they want, because that's what people want, they want quality of life, we have to understand how is the structure interacting with the function, interacting with the health. And when we're able to look at all of those together, then we have all of the ingredients to put together a plan to help somebody get back to their lives.
All right, so basically just quick explanation. Where are you?
Yes, again.
Okay, quick explanation. So this is just 4 videos that you did for your company. These are like pre-done videos that someone did for your company, right?
That's right. So I'm just making the content, but someone else is producing them.
Okay, cool. And then we're just commenting on them, but my voice is this way because I had COVID really bad for a month. So it's a
Yeah,
little
you still
bit,
sound nice, though.
yeah, it's not quite. It's
Got a good tone.
Not quite my deep, sexy voice in the past that I've had, but you have to excuse it for the next 4 videos, please. All right.
Absolutely.
On to the next one.
Let's go.